Hello, today I'll be demonstrating how to do blood draw. And first, I'm going to check the doctor's orders. He wants me to draw blood for some testing, and I'm going to check that that is appropriate for this patient. And yes, it is based on the condition of the patient and what the MAR states. I'm going to go ahead and gather my supplies. I'm going to make sure I get some blood tubes and that they are not expired. I am going to get my needle and the rest of my supplies. As you can see right here, tape, gauze, and make sure that my needle for drawing blood is big enough so that it does not hurt the blood cells. In this case, this is a 21 gauge. I'm going to go to the patient's room. Come in. Hello, my name is Eddie, and I'll be your nurse today. And the reason why I'm here is because I'll be drawing some blood. But first, can you tell me your name and date of birth? And I'm checking his wristband, and he's giving me his first name, last name, and date of birth. I'm going to give the patient some privacy. I am going to raise the bed to a nice and good working position for me. Do you have any questions about the process of drawing blood? And do you know if you have a good site, a good spot where I can actually draw blood? Usually your forearm. Okay, well, thank you. So setting up everything. So I'm just gonna go ahead and put the tourniquet on just to see if I can feel for a good vein, and then we'll get started. All right. So first I'm gonna set the tourniquet, and then I'm just gonna feel. This looks like a real good vein, and it's in the on the median cubital vein, so it's the forearm. So it looks like that's a good site. All right. So I'm gonna go ahead and get my equipment prepped and get things ready. There's that. I have my gauze here. Got my tape. Piece of tape right there. And once again, I'm going to perform hand hygiene. And I am going to glove up. All right, so I'm going to go ahead and clean the site. Clean it real well. Scrub, get in there, and then I am going to let the site dry. I'm not going to blow on it or fan it. I'm just going to let it air dry. Site is already air dry. The patient doesn't have any questions, and I have the right patient. Do you know if you have any allergies to latex or anything like that? Any allergies that you're aware of? Patient does not have any allergies. So I have my site prep. I'm going to go ahead and apply the tourniquet. Tourniquet is on, and I'm going to use gravity. So I'm going to have the patient just, rest their arms on the bed. If this was the doing this at the hospital, bevel up on my needle and I'm going to go in at a 30 degree angle. I am going to set my finger, and we're gonna lock to hold the vein in place. And like I said, I'm gonna go in at about a 30 degree angle with bevel up, and I'm in, and I can see blood. See a little flash there, and I'm gonna go ahead and insert one of my tubes. Are you feeling okay? I see that I'm getting really good blood flow, and this is filling up pretty quick. Vial is full, so I am going to pull it out and insert the second one, and I am going to shake this one 8 times to get everything mixed together. I'll be sure to label each one of them before I leave the room. Vial is full, so I'm going to remove the tourniquet, shaking the vial, and then I'm going to grab my gauze here and put it over the needle, not adding pressure at this point in time. It's just sitting over, and as soon as the needle's out, I'm going to add pressure, lock my needle guard, and